like it's helping young girls to get a bit of confidence in themselves and, you know, the awareness of the baby.
And the arts enable us to look at things from a different perspective.
And then a couple of months later I got my torso done.
The dreaming took them all across the land. There was always the baby born in their camps by the tribal grandmothers or grandfathers attending their birth. In many sacred places they have the hand marks on the rocks or on the trees or on the in all ceremonial grounds.
Auntie Marg, Auntie Pauline, Auntie Lila, they all are established artists and their work's held in Canberra National Gallery collection.
So what wasn't happening was particularly that we were trying to get young mums to come to a young mothers group. It encouraged the girls to come here and feel safe and nurtured on the health setting where traditionally they mightn't have felt that. So it was us as a health team with the arts lady Jo. So having somebody who could mentor us to do something artistic, we just all ended up having such fun.
Get it done because it's a memory that's going to last a lifetime.
So it's because it was in a group and it gave us time and we were relaxed together. It wasn't the pressure of appointments, you know.
You know, they taught us what it was going to be like in the labour wards.
One would be sitting breastfeeding and another one who might be thinking, oh, I'm not sure I'm going to breastfeed, shame, might then think, oh, yeah, I can see that's a good thing.
She's healthier because I kept her on the breast too. You know, I just wanted to keep it up to as long as I could.
You know, we haven't been that good at getting alongside. We've more, you know, dictated, educated, whatever. This was more like, here we are together doing a project, side by side, we're equals and kind of nurturing each other. That's what it felt for me when some of the girls were like making a mould of our hands as midwives and health care workers. And that felt like it was a nurturing coming back, you know. We all need it. We all need to be nurtured and encouraged and to feel we're doing a good job, whether it's as a mum or a health worker. You should have seen the number that turned up to that exhibition, you know. Even just talking with the curator at the art gallery, she said she feels since that project that she thinks twice as many Aboriginal people come into the art gallery feeling as though this is our art gallery. And so there were repercussions, I think, right through the community.
Because I was an MC, first time to be an MC. They give you opportunities to do things like this because they know you can do it.
Sheralda is now being mentored with Beyond Empathy.
I want to be there too, just so I could be like the midwives were for me. You know, someone who I could sit down and talk to when they need someone to talk to.
There was one registered nurse from out at one of the outlying areas. She'd worked there for 19 years. And in that following week after the Mubali exhibition at the art gallery, she sent me an email just saying, it gets me a bit choked up, but she just said, I've been working for 19 years with these communities, and she said, I've never seen anything that's really made a difference. But she said to go to that exhibition and see young mums lifting their heads up and standing up on the lectern and speaking through a microphone.
Because a lot of young Aboriginal girls that are walking around now that like, some of them feel worthless because they've got children. I did feel like that, but because of this I don't.
You can tell in your guts if something's really working, and this is something that really worked and built us up as well.
Because being a mum ain't going to stop you from doing other things. It's just going to make you stronger and get out there and do it.